Tummy tuck is a surgical procedure, also known as abdominoplasty, where a patient after losing weight will have excessive skin. So the excessive skin is addressed where the skin is removed. Along with that, the patient may also have a protruding abdomen because of weak musculature. So that's called a ventral hernia. And the muscles are tightened and where the abdomen is made flat. The navel, which is low lying and hanging, that is also repositioned into a much favorable location. So there are three components where the skin is removed, the muscle is tightened, and the umbilicus is located to a new position. Depending on the excess amount of skin on the abdomen, we choose to perform one of the types of abdominoplasties. Now, there are classically three different types of abdominoplasties. One is the standard tummy tuck, where the incision extends from the hip bone to the hip bone. That's the standard. Now, some patients may be very thin, may be very petite, and in these kind of patients where the skin excess is very, very minimal, we decide to choose to do a mini tummy tuck, where the incision is much smaller. It's much within the hip bones. The incision is very, very small. That's why it's called as a mini tummy tuck. Now, there are patients who may have lost a lot of weight and who may have excess skin even on the sides, on the flanks of the abdomen. So, in these patients, we choose to do the extended tummy tuck where the incision extends much beyond the hip bone. So, these are patients who have lost too much of weight and there an extended tummy tuck may be required. As plastic surgeons, we get asked this common question, whether a tummy tuck is suitable for me or whether a liposuction is more suitable. This is what we commonly get asked. Now, from the plastic surgeon's point of view, a tummy tuck addresses excess skin. So it is only meant for those patients who have lost a lot of weight and who have sagging skin. So tummy tuck is for them. Now, whereas liposuction, it addresses all the localized fat deposits in the body. So patients are within the normal BMI or in their weight range, but they may have certain amount of fat deposits, not skin excess, only the fat deposits. So that is good to get rid of by liposuction. An ideal candidate for a tummy tuck is one who's in the ideal body weight, has a good BMI, and who has had weight loss over a period of time, or who has had a bariatric surgery, or maybe in the post-pregnancy period they have lost a lot of weight. So there's a lot of skin excess, and this is the ideal situation where you need to do a tummy tuck to get rid of the unwanted skin. Now, depending on the tummy tuck you plan to have, it could be a mini tummy tuck or a major tummy tuck or an extended tummy tuck. The procedure varies. Now, a mini tummy tuck is a minor procedure where the tuck can be done in an hour or so. Now, this is done as a daycare basis. The standard tummy tuck typically takes 3 to 4 hours, and after the recovery, you would be kept in the post-operative unit, and then you would be shifted to the room in the same day, and you would be probably hospitalized for 2 to 3 days before the drains are removed. Typically, a tummy tuck procedure will be combined with liposuction, so there's going to be a lot of dead space within the body. So to drain off all the dead spaces and to have comfort levels for our patients, we give compression suits for these patients, which the patients will have to wear for a period of 3 to 4 weeks. The recovery period, the patient usually have to stay in the hospital for a period of 3 to 4 days. After that, the patients get discharged and they call back again after 5 to 7 days to check the incision lines and or probably for check dressings. And usually when the wound is dry by 7 to 10 days, and then we start the patients on massages, and these massages will have to go on for probably for a period of 3 to 4 weeks for the swelling to come down and for all the lymph to start draining into their usual positions. Tummy tuck procedures are cosmetic procedures and are usually not covered under insurance, but however, there may be some women who who may have a rectus divarication or a weakness in the abdominal wall, where this particular entity may be covered under insurance, and this is the only entity which probably the insurance will be able to cover. But the other procedures, like a mini tummy tuck or an extended tummy tuck or a full tummy tuck, these are cosmetic procedures and are not covered under insurance. The costs may vary between 2 to 3 lakhs depending on the setup you choose to have your surgery done.